Good morning, Treatment for All. My name is Maggie Carmona, and I'm very excited and thankful for this opportunity to be one of the finalists for the short-term consultant position at Total Life Clinic. Before I dive into the assignment proposed for this interview, I'd like to give some background information on myself. I was born and raised in Lubbock, Texas, and moved to Massachusetts for undergrad, where I received degrees in psychology and healthcare administration from Stonehill College. After college, I worked for several years at a mental health clinic at the clinical level. I completed my Master of Social Work degree from Boston University last year, and I'm currently pursuing my Master in Public Health degree from Boston University with 1 semester left. While I was pursuing my Master of Social Work degree, I had the opportunity to hold 2 practicums. One was at Cambridge Health Alliance doing community improvement efforts, and the second was at Boston Public Schools Health and Wellness Department doing health and wellness policies and promotions. I feel that my experiences at the clinical level, community level, and system level will all be beneficial in being a consultant for Total Life Clinic. I feel like I'll have a better understanding of supporting the clinical staff and the burden that they feel, while also helping the clinic level at the system registration level to improve wait times. And so I thank you for this opportunity, and I feel that I want to go into this work with the goal to listen and learn from the staff and patients there to find what is going to be the most effective and feasible option for Total Life Clinic. I thank you again for this opportunity, and now I'll present on how I would approach this work. Thank you so much. I'm going to approach the work that needs to be done at Total Life Clinic, also referred to as TLC, through a quality improvement lens. We will take a look at the background and current issues of TLC, and then I'll introduce how I could support the TLC team in improving their current issues. Let's first review the background of TLC. TLC is a Treatment for All flagship center in Conakry that addresses HIV and AIDS in the community. The clinic resides in a large public hospital and provides care to about 18,000 patients on antiretroviral treatments and has 8 physicians on staff. TLC experiences approximately 3,378 medical visits monthly, which equates to approximately 44,856 visits annually and 179 visits daily. In addition to medical visits, patients also visit the clinic for non-medical appointments to collect antiretroviral medications and receive lab tests. Between 2009 and 2010, the pharmacy received 129,179 non-medical visits. With this high volume of patients, TLC is currently experiencing 2 main issues. The first is excessive wait times. The second is overburdened staff, particularly among their 8 physicians. Now that we've reviewed the background and current issues, I will discuss how I would approach these issues, deliverables I would develop, ways I'd implement solutions, and challenges I would expect to arise. First, my approach would be through the Plan, Do, Study, Act model. Through this model, I would first identify and select the problem, analyze the problem, generate possible solutions, and select and plan the solution. Next, I would implement the solution on a trial basis, evaluate that trial implementation, and if successful, scale up to implement system-wide. With my approach, my 2 main goals are to assist TLC in understanding their patient flow and to offer ways to continuously improve the quality of their clinic. Upon my review of TLC, I expect to develop the following deliverables. First, I would conduct a needs assessment to gain an understanding of what providers and patients feel is the problem. It is important that I not only form my own opinion through my research, but that I hear from those impacted as well. I would also develop a more efficient registration system. Much of the wait time is during registration, and all patients for medical appointments and the pharmacy have to go through the same registration. I would aim to separate the 2 and consider technology solutions that could make registration more efficient than writing by hand in the Blue Book. Several apps can be created specifically for TLC through different platforms such as ComCare. Once research and registration changes were completed, I would create a new patient flow map with input from the staff. This would also include any changes made within the hospital should there be a better place for patients to go for non-medical appointments. To support these changes, I would also plan to conduct trainings on communication and develop resources on patient flow and communication that could be left at the clinic for resources. Additionally, I would develop 2 job descriptions, one for a physician to help alleviate physician burden, and the second for a care coordinator to support the new patient flow. Lastly, I would create a program that could take place once per month or as often as needed that would support the well-being of the physicians who are overburdened. Returning to the Plan, Do, Study, Act model, during the planning phase, I would conduct a needs assessment, look at technological options for registration, and where in the hospital patients may be able to get non-medical services. I would also form a group of people from the clinic, hospital, and pharmacy to help select and plan solutions with. Once we decided on the best course of action, I would support implementation of the program with communication workshops, trainings, and handouts. Once our trial had ended, I would evaluate the wait times and staff burden to see if it had an impact. If our selected solutions were successful, we would look at ways to expand our implementation. Although I am looking to conduct research and gain staff and community input, I recognize that we may face some key challenges. One could be hospital support, should we request non-medical patients be seen elsewhere. We may also face challenges with our current patients. Currently, 80% of patients arrive before 9:30 a.m. because of wait times. Ideally, if our wait times improved, patients would be willing to come in later in the day so that patient arrivals are more evenly dispersed throughout the day. However, they may struggle getting used to the new system and trusting when staff tell them that they won't have to wait as long. Lastly, we may face funding challenges, since it is unclear if there is funding for additional positions or technology purchases. I am hopeful and excited about this opportunity to support a program that is doing such vital work. I thank you for your time and this opportunity. I look forward to speaking with you soon. Thank you.